Okay, so I'm going to talk about the lat pull-down in the context of rotator cuff impingement syndrome and/or anterior instability, which of course is commonly found in impingement syndrome. I know this doesn't look like a lat pull-down, but I'm going to give you some foundation or a quick reminder for professionals. But if for those of you who are viewing this video like this for the first time and don't know what impingement syndrome is, this is a pretty good image to go by. So that little circle that popped up there in the upper arm bone called the humerus, and the structure arising from the scapula there is the acromion, and we're going to look at the supraspinatus impingement point. That's what we're looking at, and that's the muscle there. It's the rotator cuff muscle that is very commonly impinged upon, and the supraspinatus arises from the scapular fossa to attach to the head of the humerus on the greater tubercle. Okay, most commonly it is the tendon that gets impinged upon, but both the muscle and the tendon can be inflamed or damaged there. Another thing that can be inflamed is the bursa. So there's bursa in through that area here of impingement. Bursitis is the medical term for that. So the itises are, of course, inflammation of whatever it is that you're talking about, being tendon, tendinitis, bursa, bursitis, same kind of thing. The acromion is a process right here. It's the tip, and oftentimes with those that do have impingement syndrome, it's more likely if you have a hook on that. So this is very flat. Actually, this picture looks like almost like a negative type 1. There's three types of these hooks there on the acromion called grade 1, 2, or 3. So the grade 3 would have a great hook, and oftentimes in surgery they will plane off the that hook there to try and reduce the risk of impingement. Okay, so that'll give you a good little foundation, a little quick reminder, a good base, because it's going to be relevant to the next slide, starting in the lat pull down. So let's switch over to that. Okay, so we're going to talk about the lat pull down exercise for a bit. This is one of the most common exercises in the gym that you will see, and because it's so common, I've kind of chosen to focus in on this video here, because if you do this exercise incorrectly, it can really increase your risk of shoulder impingement, and you'll see that with a lot of pressing and pulling exercises. But this one, let's take a look at why in the next slides as to why you might want to reduce your range of motion if you have a history. So in this middle slide, if you have no history of shoulder impingement and no history of anterior instability, then most people are not going to be negatively affected by pulling the bar down to the clavicle or pulling it down to the upper chest area. So that is very traditional, full range of motion, perfectly safe if done correctly. But like I said, I've been doing this for over 17 years, and I've seen over and over again the mistake that is commonly made when you pull the bar down to the upper chest, and we're going to go into those details. Here's a side view. Again, I am flipped around sideways. That you're not really supposed to be on this machine, but for imaging, it will work, although ideally I would normally have that cable line go straight down. It's a little bit back, but again, no big deal for what I'm about to show you. So here in the left, again, you see this nice starting position and the finished position into the chin. Incorrect form, you'll see off on the right hand side of the photograph with the elbows and forearm pointing back. So let's unwind that in the image below. Okay, so are you ready to go over why the lat pull down can be quite problematic for certain populations? Well, this is why. If you look at the left hand side image, you'll notice that the orientation of the forearm is nice and vertical. In the right hand image, however, the forearm and elbow are pointing back. which is going to tilt the plane, as you can see. This causes actually a wrist problem, because if you look at that, the wrist extension, hand extension, also be causing inflammation to the wrist joint and potentially, in addition to potentially the shoulder. So there's a number of reasons beyond just the shoulder as to how deleterious, actually I believe that's a word, this exercise can be to both your shoulder and your wrist. Okay, but let's go back to the left-hand side image for a second here. I have, if you notice the arrow there that represents the humerus, it positions the humerus back, and so that the arrow is representing, the backward pointing of the humerus, where if we go back to the right, it's actually in the opposite direction, pointing in the opposite direction. So anterior and superior, meaning forward and up. So increasing the likelihood of that arm bone bumping up that acromion process that we talked about. So really, really not good. And which leads me to the final slide, and I'll ask you, can you have good form, and pull the bar all the way down to the clavicle, upper chest? The answer is you can. And I've included the image here to show you that if you take a look at this, this is perfect form right down to the clavicle, although my neck is in a little bit weird of a position, but that's because I'm sitting on the cable machine the incorrect way for the demonstrative purposes. So barring a few minor corrections that I would make on the form, I have the shoulder flexibility and the coordination and the experience required to do this exercise without endangering the shoulder joint. But my whole point in this video, I hope that the takeaway, especially for professionals, physical therapists mainly, or maybe chiropractors that are encouraging their patients to do some kind of exercise outside of their adjustments, that it's very important to have good form with that lat pull down, because it can really increase your risk of wrist and, like we had gone over there in the slide prior, and shoulder injuries. So I keep it real simple, because I know that patients and clients are more likely to do incorrect form when they're not being monitored, and they're more likely to add on more weight. And so with improper weights, or to too much weights, basically, it's going to be more than likely to drive that elbow and forearm back. But even if you're doing light weights, if you're super tight, you've got a tight chest or imbalance of the internal versus the external rotators, which is very common, and it's very common those have history of rotator cuff and impingement. So why not reduce the risk by reducing the range of motion, stopping at chin level? That's my recommendation, over seeing this many, many, many times over the course of now over 17 years. I thought I'd share this little clinical thing that I've noticed, and really feel compelled to get the word out there. So hopefully it was helpful, and enjoy some of the other videos. I'll be expanding on the impingement syndrome and some videos to come here. So stay tuned.